My man! Welcome to the show. How are you? Really excited as a parent and as a person of color to have our guest today. Hey, what's up, everybody? Hey, guys, what's up? It's Irfan. Hey, guys, what's up? This is Irfan Joffrey on the Sunny Side Up podcast. I'm excited to have our next guest, who I have a tremendous amount of respect for and I admire. He's been a Roosterly client for some time now. Dr. Aaron Williams, welcome to the show.
Pleasure. I'm so glad that you asked me to come in and have a discussion with you. And thanks for carving out some time for me.
Oh gosh, thank you. So listen, from the time that I met you, I've been blown away by your background and your journey. You know, all the times I've had the opportunity to speak with you, I always leave that conversation better for it, right?
Thank you.
You know, your wisdom, your philosophy, how you think leaves an impact on people, and that's really a prerequisite to being on my show. So let's talk a little bit about this. You are a pharmacist, you are an MD, radiation oncologist,
Yes,
as well as an MBA.
Yes.
All right, and you're an entrepreneur at the end of the day.
Right.
You've built and launched cancer centers across the country, which is exciting, and I want to get into that. But let's take a step back, because we've got a lot to unpack. Where did you grow up? How did you develop an interest in medicine? There are very few minority physicians, I would say, African Americans. And of those individuals that have both an MD and a PharmD and an MBA, you are 1% of 1%, I would think. So how did you develop that interest? How did you grow up with? Did you come from a family of physicians? Talk to me a little bit about that.
That's a good question. I didn't necessarily come from a family of physicians. I did have some cousins that were in the medical field, pharmacists, as well as a couple of physicians, but they were from a distance standpoint, they were not necessarily, I would say, right there to influence me. So let's just say they influenced me, at a distance. But I still didn't get the reckoning to know I could even like medicine or do medicine until I went to the summer program in Tallahassee, specifically at Florida A&M University. They had a summer program, and for 8 weeks you come on campus and you learn about, you actually take many courses in the actual courses that you would take in their pharmacy program. You also got exposure to other healthcare professions. So we toured a veterinary school, we toured a medical school. We were already at a pharmacy school. So at that point, that summer, I got like a good a synopsis, if you will, a small synopsis of what healthcare would be. So that really confirmed my initial inkling that, God, healthcare would be nice, and science is also cool too. So that kind of got me started. Then after that, I did end up going to Florida A&M, and I think the thing that catapulted or increased my interest the most was I was able to get involved in biomedical research at the age of 18. At that time, 75% of the student body was involved in biomedical research. So the summer after my first year, that's what I was doing. And I was in a lab looking at compounds and experimenting with compounds that treat cancer. So that's where my interest in cancer began, even though I was not had no idea at that point I wanted to go to medical school. But the fact that I was able to look at, take this abstract idea of treating cancer, and now I have it in my hands, potentially, so to speak, that blew my mind. And, during that year, when you see that you can make certain compounds, like the first time I made aspirin in a lab, I called my mom, said, "Mom, I just made aspirin," So that's where science was cool to me, and science really oh man, I think I like this. I think I'll stick with it.
Okay. Now, did you were you exposed to healthcare in prior to that? Did you have any kind of preconceived ideas of going into healthcare at all
Not
prior
at
to that?
all. I was into music at the time. I wasn't a nerd, but I played in the marching bands and fun. I thought I was going to major in music, and
Nope.
music still was a big part. That was another big part of me going to Florida A&M. I was able to go on a band scholarship, but I majored in pharmacy, and I really had thought about either going into engineering, music, or something of that nature. Medicine was kind of far off until I went to that summer program.
Got it. Got it. So you complete your PharmD studies
Mm-hmm.
and you've been working as a pharmacist, or did you go right to medical school right
No,
after
I
that?
worked as a pharmacist for 2 years. I was trained as a clinical pharmacist, and I just like the interaction of, most people have the idea that, pharmacists only work in the silo or work in one place and just, count pills and that kind of thing. But, we're really trained to do a lot more than that. And that's where this birth of what we call clinical pharmacy has exploded over the past, few decades. Pharmacists now are specializing just like physicians. You have pharmacists that are specializing in pediatrics, specializing in cardiology, and that mainly because we have so many drugs that are out there. But at the same time, we're making a lot of progress, and that progress demands focus. So that kind of was my interest during those 2 years. I worked at a hospital, and as a clinical pharmacist, you round with the doctors, you round with the team, so to speak, and the physicians and everyone kind of relies on you to be the drug expert. But during that process, the more I got into patient care and being surrounded by patients and the hospital surroundings, the more I said, I wouldn't mind going into medicine. And I tell people all the time, I transitioned from pharmacy to medicine, not because I didn't like pharmacy. It's just I also found something else I like to do. I never let pharmacy go. Even to this day, I'm still a registered licensed pharmacist. And so I just found two major professions that I like.
Very cool. Very cool. So it was sort of a natural progression of your.
Yeah, it was. You summed that up well. It was a natural progression. The more I got exposed, the more I wanted to learn and do.
What would be your advice to young people of color when it comes to evaluating the direction of their careers?
Yeah, I think the biggest thing is a matter of exposure, and that's what got me. I didn't know I wanted to do till I was exposed to it, and so I would say expose yourself to, now of course not the bad stuff, but expose yourself to everything that you can. One person told me when I was thinking about going back to medical school, I was a pharmacist at the time, and the guy told me, it was a physician. I said, again, I was working in a hospital, and I just casually said, I'm thinking about going back to medical school. And he said, if you have the inkling to go, I suggest you explore it and do it. And that's what I would say at this point. If you have an inkling, I would suggest that you explore and do it. Not meaning that you're going to do it, not necessarily meaning that you may end up being a physician. Physical therapy is a great healthcare profession. Pharmacy is a great healthcare profession. Nursing is a great healthcare profession. So all of those, I think, if one gets exposed to, and then also the bottom line is you got to, care for people, care for patients, care for sick patients. And that's one thing, one of my chemistry professors who I asked to write me a letter of recommendation for medical school, he looked at me, his name was Dr. Turner, and he said, now, if you become a doctor, you're going to have to take care of the people that are nice and clean and have a lot of money, as well as the poor guy who happens to be dirty and unkempt off the street. And I said, yes, sir. So it's that caring part that you also have to have besides the interest in science.
Absolutely. Absolutely. That makes a ton of sense.
Mm-hmm.
Now, this might sound like a rhetorical question,
Mm-hmm.
but how do you incorporate purpose into your work?
Well, I think that's where the caring comes in. Okay, so you got the caring part. Hey, this is another human being that's been diagnosed with something or needs help with some type of health issue. So I think that's one of the biggest purposes. And then it reverts back to me as a person and say, how can I, with whatever I've learned and whatever I've experienced, help this person, with that. And so I think a combination of wanting to help, other people, and the combination of, kind of satisfying what, you or I have defined as my interests. And that's, some people would say that that's a gift. And I'm not saying that's necessarily something that was bestowed on me, but I do like science, I do like medicine. Obviously, pharmacy and medicine is a long haul, so it's got to be some type of interest and love for it. And I can say that probably what has gotten me through school as well as career.
Got it. Currently, you're a busy guy. You've got your cancer centers, you've got your social media, you've got your day job and other things. What are two questions? How do you prioritize your time? Right, that's a big job in itself. Right. And what is a typical day like for you?
Well, I guess the biggest thing is to thank goodness for pen and paper and a date book. Every year I buy the next year's big date book to kind of put down what I need to do, and as one motivational speaker always said, think on paper. And so to me, the challenge is trying to stay organized. As far as priority, patient care is, I guess, the biggest priority, and making sure I'm taking care of the people that I'm responsible for. But then also, of course, family and making sure I do what I need to do from a business or entrepreneurial standpoint, because that's also a learning scenario that I and most entrepreneurs continue to evolve with. So it's a matter of time management, if I had to sum that up.
Understood. What are some of your biggest challenges right now?
Time management, deciding what is most important, and learning to work with other people, not in a bad way, but making sure that whoever I'm working with has the same vision and same work ethic and idea as to, hey, how we're going to accomplish this and achieve a positive outcome. So I think that's the biggest thing. And on top of that, staying on top of my own health. That's making sure I'm, I can't tell somebody to maintain a good diet when I don't. So right. I have to take my own medicine.
All right. So a little bit more in terms of your typical day. What time do you wake up? I want to walk through it.
I am up at 4.
Okay.
Yeah, I'm up at 4. And I'm also, I work at an addiction clinic in the morning because I do, because I have an interest in medicine and drugs. I am doing still doing some work in addiction medicine. So I work there, 2 hours, and then I drive another hour to my cancer practice, and I'm there all day for the rest of the day. So it's a good 12 or so hours at minimum a day, and in between you're trying to fill in all the entrepreneur blanks and put on other hats, if you will, because one thing we're not taught to do in medicine is the business side of medicine. I think that's one of the reasons I chose to go work on an MBA, because I wanted to learn the business side of medicine, because that's also important too. You can't pay staff, you can't provide services without knowing how to manage certain things, particularly in radiation oncology. Radiation oncology is not the type of field you just hang a stethoscope and go and do your work, the machines that we use, Linux accelerators, are very finicky, require a lot of technology and a lot of attention. And with that comes, a lot of costs with regard to service and parts. And so you have to make sure you're balancing all of that in order to provide good treatment and care for the cancer patient.
Understood. How do you think your industry will change over the next 12 to 24 months? What are some things that you're seeing on the horizon?
That's one of the beautiful things about radiation oncology and technology. It's something every year, every other year. You go to the conferences, there's this new way of delivering radiation. Mind you, the goal of radiation is to deliver the most therapeutic dose of radiation while minimizing the amount of radiation to normal tissue to prevent side effects. And, the industry just keeps perfecting that. And so it's very important to stay on top of that. Anytime we can adequately treat cancer without having side effects, that's always a bonus for the patient, the patient's family, as well as, us healthcare professionals. So it's one of those things that it's nice to be in a field that's not stagnant. And because it deals with technology and treating patients, it makes it more interesting.
What are some of the things that you're doing at your cancer center to differentiate yourself and your practice from others?
Well, I think the biggest thing, I guess our first focus is what I kind of just mentioned, which is to make sure we have the latest technology. And that's not cheap, but not either to acquire or to maintain. But the biggest thing is to make sure we have the latest technology, make sure we have all the service agreements and all that aligned to if that technology does require repair or servicing, we're able to do that. But I think what we're moving into now is not only being there in case patients are diagnosed with cancer, but we want to be a service to the community and say, we want to show you how to prevent cancer or to decrease your chances of getting it. Or if you do, we have a more of a successful rate at achieving a positive result. Over the past few decades, the American Cancer Society has shown in its publications that even though almost 2 million patients are diagnosed a year with cancer, and unfortunately, maybe around 700,000 or so, die of cancer. Right now, as we speak, there's about 18 million Americans in this country that are still living that have been diagnosed with cancer. Now, that partly has to do with, we've come a long way with regard to treatment, as far as radiation therapy, as far as chemotherapy. Now, what's very popular is immunotherapy. And sometimes we use one of those individually or in combination to treat certain cancers, because all cancers are not treated the same. But the biggest factor is early detection. The earlier we can get something, the more we can do about it. My conversation and a consultation is a lot longer when I have a patient who has an early stage of cancer, because I'm now saying, hey, these are your options that I or we are recommending, compared to if something that has already kind of spread into the final stages, then we're more limited as to what we can do. So I say all that to say prevention, early detection is probably the best way to service the population. So in our practice, we're moving toward providing this preventive early detection media in order to get people in, to not be afraid of having a prostate exam, not being afraid of of having a colonoscopy. You just wouldn't believe the number of people I have to try to talk into having a colonoscopy. And, whereas colon cancer is one of the most preventable cancers if you catch it early. Okay. And so prostate cancer is as well. Not everybody falls into that category, but it's certainly certainly a goal that could be accomplished. So I would say preventive care is probably one of the things that will help us as a practice become full circle, not only being able to treat, but also be able to say, hey, look, this is what you need to be doing if you're this certain age, or you're this gender, or if you have a family history. These are some genetic tests that might benefit and help you, avoid, or if you are diagnosed, get treated
Okay. So the messaging really comes down to a difference between age groups, genders, and genetic history.
Exactly. Yes. Yeah.
Got it.
Exactly. Yeah.
And is your request to people that might be listening into this, get tested every year, every 6 months? What?
It depends on the cancer. You know, for example, if you have a family history of any type of cancer, whatever that recommendation is for that type of cancer, the guidelines usually will recommend that you get tested earlier. Some people, for example, you know, if they have their first colonoscopy in their late 40s or 50 and they find no polyps, well, that person is probably gonna be told to, you know, come back, you know, a lot longer time frame than someone who, hey, we found 3 polyps and we think you need to come back, you know, 5 years or 5 years versus 10 years. So it just kind of depends on the individual. You know, what is being, I'm just using colon cancer as an example. Or if there's some genetic testing that proves that there's some type of genetics that puts a patient at risk.
Got it. Is there a specific book or podcast that you would recommend to folks? Not your own, but that you would recommend that has had an impact on you.
Can't talk about the Weekly Wellness Show? No, I'm just playing. You mean with regard to healthcare or just in general?
I would say both. Like, what is there a particular book that had an impact on your life?
There's several. I remember a long time ago getting exposed to The Power of Positive Thinking by Norman Vincent Peale. Okay. I carried that book because what I've learned in life is that you have to always, while you want to put yourself around positive people and positive environments, that's not always going to be the case. You have to learn how to self-motivate, if you will. And I end up buying two of those books over time because I wore the other one out, you know, just carrying it, you know, paperback. The Magic of Thinking Big by David Schwartz, I think, is something I still have in my close access to. And when the Secret came out, that was pretty hot. I liked The Secret. It kind of brought a different perspective than other motivational self-help books. And Think and Grow Rich. This is a book initially authored by Napoleon Hill, but recently Dr. Dennis Kimbrough did a type of involved the essence of that book with kind of, you know, modern issues and challenges. And I actually got a chance to meet him. Real nice guy. But yeah, Think and Grow Rich by Dr. Dennis Kimbrough. So those books kind of, you know, help with motivation and staying on top of things and staying positive.
Now, I've noticed your Instagram. I've noticed you on social media. It seems like you use those primarily as a platform to educate others. Talk to me a little bit about how you're using social media, and also, you know, let's sort of weave that into the weekly wellness show as well.
Well, yeah, it's really I like to look at it as an educational platform. In fact, even with my podcast, it's not a podcast focused on me. It's me introducing and talking to other healthcare professionals about what they do every day for patients. So it's a matter of educating the public on, you know, what they could do to help to improve their health. You know, for me, I'm an oncologist. I'm not a foot specialist, but, you know, I had a podiatrist on a couple of times just to talk about foot care. I'm not a cardiothoracic surgeon, but I had a cardiothoracic surgeon on to talk about, you know, how to take care of your heart and that kind of thing. So and the beauty of that in doing those type of things and trying to come up with topics for these platforms is I get to learn some things myself. Medicine is something that you can't like just go to school and get your degree and then go home and sit down and you're set for life. From a benefit of your career, benefit of the patient, as well as licensure, we're required to have a certain amount of continuing education hours every year. So with that, it forces you to go back and say, oh yeah, that's what they're doing now, and this is the new recommendation. So it's an educational part for the general public, but also an educational part for me because you know, I wouldn't know the latest of what they're doing in cardiothoracic surgery, but a cardiothoracic surgeon would.
Got it. No, that makes sense. So you're using your platform to educate and spread the word by incorporating individuals that you respect, whose knowledge that you respect, that may be from different disciplines.
Right. Exactly.
Got it. What is your overall objective with social media? Where do you hope to be with it a year from now, 2 years from now?
Just expanding from a national to an international a reach, so to speak. You know, social media is just like fire. It can burn down your house, but it can cook your food. So it depends on how you use it. I don't know why I thought of that one analogy, but that's, you know,
I like it.
So some people are on to do certain things. I said, well, you know, I think done properly and done with a lot of homework and making sure that whatever you're saying or doing is backed up by the literature, backed up by you know, the appropriate organizations within that specialty, then you provide a service to the public and to your own local community, as well as to other physicians and healthcare professionals.
Got it. You know, it's so interesting in whether it's TikTok or Instagram. You know, you and I were having this conversation the other day leading up to this conversation, and we talked about how we see, especially me, because I'm this is what I do. I see folks every day, whether on TikTok or on Instagram, and they have no factual knowledge in some cases.
Yeah.
However, and in their industry, there may or may not be a governing body, but they present their information with such confidence that they build a following, and people are, you know, swearing by whatever that they say or do, and they're selling all kinds of things that may be ineffectual at best or maybe harmful at the least.
Exactly.
And you know, folks like you, folks that are subject to governing body and licensure and other things, you've got to think twice, 3 times before you go out and on social media and say something that could hurt people. So I just I wish there was more of that in the world, because there's so much misinformation, and it's usually from people that are peddling something.
Exactly.
Right?
Yeah. Yeah. The nutraceutical industry is a perfect example of that. The nutraceutical industry, and when I say that, this is the area of supplements and vitamins. They're not scrutinized by the FDA, particularly at the rate that a prescription drug might be. A prescription drug may take 10 years to come to market. But I can take a thimble of green tea and put it in a solution and say that I've got green tea and this can do this and do that. And, you know, it won't be as scrutinized as if I'm developing some drug that's going to, you know, treat high blood pressure or something like that, that requires a prescription. So you really have to, you know, read the labels as a consumer. Read the literature. I mean, that's one of the good things about the internet these days, even though you can't trust everything on the internet. And then the final bar is talk to your own primary care doctor and just say, hey, is this good for me? Is this right for me for what I have and what I want to accomplish?
Got it. And so just to confirm, on your own social media, you're not selling anything. You're just providing public knowledge around things that people can do to help themselves.
Right. Yeah. Exactly. Yeah, again, the goal is to educate and increase awareness.
Absolutely.
And if there's something, I had a show once on alkaline water, and I didn't present the data, but a pharmacist who was very much into alkaline water as far as studying it and having a brand, I had him on, and then we always have a disclaimer. Hey, look, this is for informational purposes. Please consult your doctor. And so I try not. I don't let people come on and make these wild claims about my mother had this 1 week and 2 weeks later it's gone. That kind of stuff doesn't fly.
It is running rampant.
But it's rampant. Yeah.
Crazy. So you're one of the good ones. I'm so happy that you're out there with judicious, rigorous thought around these things and presenting things in a way that people can understand,
right.
that helps them take care of themselves or their loved ones so they can have a healthy, long life. I think it's a noble cause, certainly. What keeps you up at night?
That's a good question. Well, I mean, all of us are here, at least in this life, temporarily, whether it's 1 year or 100 years, and you always want to make sure that you try to make every day count. Of course, we get lost. All of us get lost in our requirements that we need for our careers, for our family and community and all of that. I guess it's always like examination or a report card at the end of the day and say, God, did I do this right? What more could I have done? What would I like to do in the future, in the far off future? So, and a lot of times that's difficult to shut down. Sometimes I wish I could just take the brain and just turn it off, but that doesn't happen all the time. But yeah, that's probably it. Just life in general, goals within those segments of career, family, community, and having some type of impact. Just making sure that once you're gone, you're not necessarily forgotten, and you left your community and world better than where you found it.
Absolutely. I don't have anything to add to that because you said that so eloquently and so perfectly. But I think you and I are of a very similar philosophy. So I think that's partly why we get along so well.
Yeah, I agree. I mean, life is short, but if you focus on why you're here and what you like to do, that makes it more enjoyable, and particularly when other people can benefit from it, that makes it extra enjoyable.
Yeah, and it doesn't feel like work at the end of the day.
Exactly.
Right?
Yeah.
You can do a lot more in a shorter amount of time. You've been a Roosterly client for some time now, and I've had the good fortune of working with you now. Why do you choose Roosterly? Why do we tend to? Let me ask that again. So you've been a Roosterly client for some time now. What do you like about us? Why do you choose to continue to work with us?
Well, there's a responsive team. So the team is responsive, and a lot of companies, you don't get to talk to the head guy in charge like yourself.
Thank you. We're up to 46 employees now. So thank you.
Yeah. So usually you're talking to somebody that's not necessarily involved. Yeah. So that's a plus. And I think it's from a creative standpoint, working together, trying to get good content, good respectable content. You don't find that a lot because some people don't necessarily have a clue or want to have a clue about what is being presented. So I would say accessibility and the creativeness of the team in putting things together, I think is my biggest pluses with regard to it.
Thank you. I only talk to the clients that I like. I'm kidding. Get the right idea. It's interesting. When we started out, we only had a couple hundred clients, and I love talking to our clients because it allows me to live vicariously through them, right? It's like one of those Sesame Street episodes when we were kids growing up, where, you know, you go to the chocolate factory, or you go, you go to wherever, and you get to see people doing stuff. And that's sort of how I feel when I get to talk to folks like you, right? So it's super, super exciting. Now, I haven't had the opportunity to do that as we've consistently grown every year, but whenever I certainly do have the opportunity, I like today is Saturday.
Right.
I'm definitely not trying to work, but when it's folks that I get to work with like you, then I always make the time, and so do you. So I really appreciate that. Now, with respect to our team, it's interesting because now we've built functional groups based on different industries. So we've got a team for real estate, we've got a team for healthcare, and so that's why and other various verticals. But that's sort of why I think we've been able to continuously be able to produce high quality content. So anyway, certainly thank you for being the client. If somebody wants to reach out to you, what's the best way to connect with you?
Well, of course, social media. As you know, I'm on LinkedIn, and then I have a website, draaronwilliams.com.
All right,
and
awesome.
those are our areas, and I'm on Instagram, as you know, as well as Facebook. The title is the Weekly Wellness Show with Dr. Aaron Williams.
Is that what your Instagram is? How do we find you on Instagram?
Oh, Instagram is Dr. Aaron Williams.
Okay. All right. Very cool. Well, gosh, listen, always a pleasure to connect with you, Dr. Williams. Always sound advice, always well-researched advice. And hopefully we'll have you on as a guest back on the show, talking about your latest book. I know you're working on
Yeah, I'm working on that. Again, everything takes time and to do it right. But yeah.
All right, awesome. All right, thanks so much. We'll talk to you soon.
Okay, I appreciate it. Thanks for the invitation. And hey, be well.
All right, I'm gonna record. That was great, by the way. I'm gonna record the intro once more.
Okay.
Just because I didn't feel like I did a very good job, and then our editorial team's really good, and so they'll edit this. They'll make it very, very seamless. So I'm gonna clap. I'm just gonna introduce you again.
Okay.
Hey guys, what's up? It is Irfan Jaffrey on the Sunny Side Up podcast. I'm excited to have our next guest with us, radiation oncologist, pharmacist, and entrepreneur, CEO and owner of cancer centers, Dr. Aaron Williams. Welcome to the show. I'm excited for you to share some of your knowledge with us.
Thank you. I'm so glad you invited me, and it's always a pleasure talking with you.
All right, let's get right to it. I've got a bunch of questions for you.
Sure.
All right. There we go. All right, this was really good. I'll give you an update.
Okay.
We're probably 30 days in terms of, we've got a bunch of recorded shows already that we're editing. So we'll try to get this up and running. So really briefly, I did want to talk to you about promoting your Instagram and growing your followers.
Yeah.
I can take you to the moon and back. I mean, it really depends upon budget and what you're comfortable with.
Yes.
Generally, if I have a sense of, it's going to take advertising dollars. Right? Typically for something like that, you're in the $1,500, $2,500 range. I'm not sure if that's sort of what you're comfortable with. I would say
1,500 times one or several times.
6 months. 6 months.
6 months. That's not bad.
Okay.
Yeah.
It's either 1,500 or 3K. It's just how big you want to go.
Right. Well, I just think you guys have done so much. You have good content that, you haven't had to bother me for, to call me up and say, it's been good. And it'll be nice if I can increase. That just helps my awareness all over, because I have a YouTube channel that I've been, I've been using some, and then you mentioned also me trying to generate some, like do 8 different segments in one day, and then. But now that I've gotten the lights here, because that was my biggest issue. Now that we've gotten it set up, I feel more comfortable with, coming up with a topic and talking for less than a minute. And
so you know what I would do, if it's okay with you, I'll develop a proposal. One's going to be for 1,500, the other one's going to be for 3K.
Yeah.
Okay? And for that, we're going to talk about, I'll send it to you later today, but it'll be international growth.
Yeah.
So really blowing up your Facebook, or sorry, your Instagram, but also me interviewing you. And then, so that way you don't have to think about topics. We just get on every 2 weeks. We go for an hour and our team chops it up. And bam, 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 bam. So if you're down with that, just think about it. It's 2 programs, whichever one you like, we can do. But I think you owe it to yourself. Given your background, when you talk about leaving a legacy and some of these things that you want to do, I can really blow you up. I just need a little tiny bit of resources to do it. So I'll send that to you today, and then if we could come to an agreement by Monday, Tuesday, that would be dope.
Okay. Yeah, what I've done is I've gotten this. I've forgotten the name of it. I've invested and got this. And I already heard of Big View, the teleprompter app. That you can type stuff up, so you can just not have to memorize stuff. So I think that's been helpful. And and then the other thing I have used is and I loaded some videos up on my YouTube channel. I forgot the name of the software. It's where you type in your article and then it generates a video, but you're not necessarily in the video. It pulls from its library. Like if I'm talking about someone having a heart attack, well, it'll pull someone having a heart attack into the thing. So that way I don't necessarily always have to be on there, but I'm still giving information.
You know what I would do though? No, I like that. I realize that you're busy though, so I want to basically tee up all that information. We'll put in that B-roll, we'll create the video, we'll do all of those things.
Right. Okay.
Let me get you over something either later today, and then let's maybe talk early next week, because I really think we've gone as far as we can with what we're doing currently.
Right.
If you're okay with stepping it up, I can really blow you away.
Okay.
With the things we're able to do. So
well, it helps me. I mean, I'm going to East Africa and Zambia, and I was invited by an oncologist who's visiting here in the U.S. He saw my LinkedIn, and he's like, "Wow, God, this guy's done whatever." And I'd really like for you to come and help me out with what I'm doing there. So, it kind of helps increase awareness and benefits me career-wise as well.
Yep. And what I would do is if we do move forward, I would optimize your LinkedIn. I'd get access to it. Because you're not showing up for as much stuff as you could show up for it. So when somebody does a search for radiation oncologist, consultant pharmacist, et cetera, international consultant, I want your name to pop up, and it doesn't always pop up.
Okay.
So these are some of the things that I'll include, because you're like, if I had to grade you right now on your online presence, you'd be at like a 60%. So and you're already putting in a little bit of effort, so why not pump it up? And
I like to my website. I want to improve that too.
Okay.
As far as adding, just stuff and blogs. I have segments for it. I just haven't populated it.
Okay, so for that, it would be search engine optimization. That runs about $1,500 to $2,500 a month as well. So I really got to understand what your budget is and what you're comfortable with, because I like you. I'm not trying to sell you. I'm not trying to charge money. So if I know sort of what your limit is or what you're comfortable with, I can then create a program that's like suited to that. Right.
Well, let's just look at everything and then just kind of pick what I can get done.
Okay.
And, all of that would be just a good way to keep me out there.
Okay. All right. I'll send you over something later today, and then let's talk Monday, Tuesday. Okay.
Okay. All right.
All right. Thanks,
Done.
bud.
All right. Thanks a lot.
Yep.
Mm.